Welcome back, dear viewers. First of all, let me tell you friends that this video is beneficial for the person who are looking at for examination purpose, the person who are looking to gather basic knowledge, or the person who are suffering from any kind of ear problem. Then I make it sure that I am going to give them best home remedy solution. And the person who are looking at for SSB medicals, then I make it sure that this is the best video, and by the end of the video you will be able to get each and every detail about your ear. Without wasting much of the time, we should move on to the first point, that is chronic suppurative otitis media, which is commonly known as CSOM. And before starting, I would like to tell you that if there is any problem in our ear, then it doesn't mean that the problem is only in ear. Our body is really a very complex structure. So let me show you a picture which depict that our ear is connected to how many different parts of the body. And this chronic disease is not a sudden change. First of all, it ruptures our upper respiratory tract, and after which it causes acute otitis media. And I would like to tell you that our upper respiratory tract is connected to our ear through eustachian tube, which I have mentioned in the picture. This chronic otitis media affect our middle ear and mastoid cavity, which is also known as mastoid bone, and in this case a special kind of liquid is collected in our middle ear and cause it to look like this, which I am showing in your picture. Now friends, let me tell you about the symptoms, causes and treatment of otitis media. Some of the symptoms are ear ache, headache, facial weakness, and rest you can see in the picture. As I have already informed you earlier that if there is any problem to our upper respiratory tract, then it may affect our ear and result in chronic suppurative otitis media. So the problem which affect our upper respiratory tract include measles, which is commonly known as khasra. The another problem is influenza infection, which is also known as flu. The another one is diphtheria, which causes swollen throat and looks like this, which I have shown you in the picture. The another problem is disorder of ventilation. In this, the production of CO2 is reduced, which affects the upper respiratory tract. The another very serious problem is retraction pocket formation. In this case, the position of eardrum is little below than its normal position. I know that the picture looks very pathetic, but this is the real condition inside the ear. To cure this, the only solution is to have surgery. It feels very bad to tell you that the only solution for this is surgical treatment, but at the time of treatment it is prescribed to eat fresh fruits, fresh vegetables which are rich in protein, and it is strictly prescribed to avoid eating dairy products, frozen products like ice cream. So friends, here we come to our second problem, which is very common, and it is known as earwax. It is collected in the outer part of our ear, and it is formed due to the dead skin present inside the ear and the dust in the ear. It doesn't have any serious implication, but it is recommended to meet a ENT specialist once in a year regarding earwax. They provide a ear drop which you can also buy, and using a machine they very easily remove the wax from the ear. And it is very basic that one should not put anything inside the ear, as we know that it is very sensitive part and cause damage to eardrum, which may result in deafness. So friends, here we comes to the third part, that is otomycosis. It's a kind of fungal infection which generally attack the outer part of our ear. Some of the symptoms of otomycosis include mild pain, itchiness, redness, swelling, and blockage sensation. Some of the home remedy treatment for otomycosis are using a garlic oil, which means लहसुन का तेल, always keeping the ear dry, and using hydrogen peroxide, which one can easily get from dispensary, using acetic acid, which is normally found in vinegar, or by using antifungal ear drop, which is prescribed by the doctor. And it is strictly prohibited by the doctor to use antibiotics for fungal infection in the ear. So here comes the fourth part of the video, that is tympanochorosis. Let me tell you friends that we are having a tympanic membrane in our ear, which due to time, dust and untidiness form a hyaline deposition over it. And let me tell you that hyaline is a kind of translucent cartilage and it covers the eardrum and the middle part of the ear, which causes problem in hearing. Here is a picture which shows a tympanic membrane which is totally clear and a tympanic membrane with hyaline deposition over it. Hyaline deposition create problems in eardrum and middle ear. Tympanochorosis doesn't show any kind of symptoms and it is advised to meet doctor once in every 2 years. So guys, I have already told you that our body is really very complex structure, as you will be amazed to know that our ear is also connected to our nose through eustachian tube. And in DNS, which means deviated nasal system, due to lack of oxygen to a particular site, it may affect the hearing of a person. So finally guys, here comes the end of video and I request you to stay tuned with me, because in my next video I am going to upload a hearing assessment test which will be very beneficial for you.